household income has been devastated by healthcare costs. Devastated. This is a great book. I've been giving this out to CEOs or CFOs, or if you're a progressive HR director, I'll send you one as well. I pay $20. It's not even my book. It's Dave Chase, great, but he's the one that wrote it. But it's packed full of such great stuff that sometimes people don't believe me. So I'm like, okay, let's go to the experts, and with all kinds of resources and footnotes. They're like, okay, how do you get that? And I'm like, holy cow, that's actually a study, and there's like hundreds of these. So if you want a copy, let me know. I'll send you a copy. This section here, it's the first chapter, and I'm going deep down the rabbit hole on this. So if you're reading this, this will, I think, help. If you're not reading it, not sure, this will help. If you have no interest in reading anything, this will help. So healthcare costs are a major issue. If you have more than 50 employees on your healthcare plan, this is important stuff. You got 2 people on your plan, doesn't matter. You're a small group, community rated, there's nothing you can do. Household income has been devastated by health care cost. Do you agree? How has household income been devastated by health care costs? What do you think? True or false? According to the article in Family Medicine from 2000 to 2009, the average annual increase in insurance premiums was 8%. And I would say that's pretty fair between 2000 and 2022. It's been pretty consistent, if not maybe more recently, the last 10 years. But let's just say an average of 8% increase. Now, most people, when you hear like, that's not bad. Some years I get 22%, 8%, that's not bad, right? 8%. In January 2022, a report came out that said the cost of living had jumped to 7.9% from inflation and from the war in Ukraine. If you were listening to this like a couple years from now, we don't know what's going to happen in the war in Ukraine when Russia invaded them, but that's what's going on right now. They're still in there. Inflation, the cost of living, gas prices, food, due to a number of factors, which I'm not going to get into, went up. The cost was 7.9% in January, 8%. People are freaking out, going nuts. The gas, it cost me $72 to fill up my SUV. Today, it cost me $40 6 to 9 to 12 months ago. Meat, I go to get steaks. It's now $27 for 2 little steaks. It probably was less than 20 6 to 12 months ago. People are going ape shit because the costs are going up, and I am too. It's horrible. It's eating into all of the money you generate as a family. It's going right out the door. So you're making sacrifices or you're cutting back, which is what you do. We all do it. All your employees are doing it for the most part. Unless you're a law firm, unless you're Google, then you don't need this. If you're making $150,000 on average, your employees, you don't need any of this stuff. Do whatever you want. But that's not most people. Most nonprofits, manufacturing, blue collar, gray collar, construction, contractors, mechanical contractors, healthcare workers, nurses. That's the heart and soul of the workforce. And guess what? If you have no employees, you have no business. So let's not pretend that because we're the CEO, you and me are the top of the food chain, and we make decent money. In some cases, I can, it's public information. Sometimes I'm looked at a nonprofit. The CEO is making $825,000. I'm like, how? That's insane. So, yeah, you're making good money. So get out of your head that your employees are not. They're suffering. So 8%, right? And this says for 9 years it went up 8%. What happens when you get your renewal at 8% and you think, it's been worse. And you take it. Or your broker, I did another video where your broker negotiates, and we all do this. All right, carrier, because it's fully insured. right? This is when that happens. It's not because you've taken on some of the funding risk. When you're fully insured, you're at the mercy of the market. In some states like Alabama, it's Blue Cross Blue Shield. You're really at the mercy, 94% market share. In Virginia, there's 3 or 4 players max. So you're at the mercy of what they say, and they won't tell you where it went. They say, well, the cost went up. We can't really tell you. There's been a few issues, but we can't tell you the details. And it's now 12% increase. 8% a year, your costs, healthcare costs, will double how fast. So if you're spending $500,000 today on your healthcare budget, you have 50 people, and your average is $10,000 per employee per year. So you got a $10,000 PEPY. You're paying $500,000 today, and you're a nonprofit. When at 8% will that become $1 million? You know? You remember the rule of 72? Your investments double according to the rule of 72, which also means your costs double according to the rule of 72. So you take 72 divided by the annual percentage. 72 divided by 8 is 9. 9 years, less than 10 years. And that's assuming it's only 8%. Guess what? We're heading into a major inflationary period in 2022. Healthcare costs are built on top of CPI, stated CPI levels, Consumer Price Index. The hospital contracts have auto pricing clauses every year that's tied to that, and they add 3 to 5 to 10% on top of that. Prices are going up in healthcare. Mark my word. They have to, because the cost of everything else has gone up. So when the cost of gasoline goes up, I'm diverting a little bit, the cost of gasoline goes up, the cost to get the supplies to the hospital for the bandages and the blood and the equipment, does it go up too? Like, everything goes up. And then there's margins on top of that, and they don't tell you as a fully insured company where it's going, so you have no impact on that. No control, zero. You're at the worst, you have the highest risk, you have no control, fully insured. So 8%, we become, the marketplace has conditioned you to accept that 8% is good. Am I wrong? Now you may be like, that's not right. No, I don't like that. Good. That's why you're listening. That's why you're going to get a copy of the book. That's why I'm going to send it to you. That's where we're going to talk. I'm not going to sell you a darn thing. I'm not going to convince you to do anything. I'm going to have a conversation about the ideas that are in here, the things that we have done that are not in here, the things that are working for lots of companies. But 8% compounded is disastrous, and it's a compounding effect. You never get a reduction, you rarely get a reduction in healthcare. Occasionally you do, and when you do, that means you've been really overcharged. Like, they have so much extra money that you didn't spend from claims. They already have to give you back, according to the medical loss ratio rebate from the ACA, they already have to give you back if they exceed 80 or 85% for claims. But if they're giving you a 3% rate reduction, oh my God, you're really overpaying. That's all that's saying. It's good news, but it's not. It should have been like a 15% reduction, but they can't go that low. It's just, that's not how they work. They being the $4 trillion healthcare ecosystem. That whole ecosystem, $4 trillion. So it said, so during this same time that healthcare has gone up 8%, household incomes, and this is page 15, household incomes rose an average of 2.1%. I know what you're thinking. Oh, we pay people well, ours went up more. Okay, good. The average. It's so easy in our brain to remember, oh no, we gave everyone an 8% increase one year. So yeah, it's been probably 8%. No, it hasn't. Average. Great, so it's 5%. So it's 8%. You gave your people an 8% average increase. It's flat. They've made no more money, but everything else has gone up. The cost of everything else has gone up over that time. Inflation has taken effect on all the buying power. And it says, if health insurance premiums and national wages continue to grow at these rates, the average cost of family health insurance premiums will equal 50% of household income by 2021. The cost, what that means is, I work for you, I have 2 kids and a spouse and a wife. I come to work for you, and I need to get family health insurance. And if you have multiple plans, I'm not gonna pick for me with a family your HSA plan, because that is way too much risk to pay out of pocket, because you pay me $60,000 a year to do my job. I'm a supervisor, I'm a manager, I'm a foreman, I run a machine, I'm a nurse, whatever, it doesn't matter. You pay me 60 grand a year. In my industry, that's probably what I expect. Great. But my healthcare costs, when I go onto your health plan, I will need one that covers things. So I'm not going to pick your base plan. I may pick your middle plan, depending on how old my kids are and how my health is. Because if I have a family, I'm not 22 for the most of the time, right? I'm in my 40s, maybe 50s. I'm in my 50s. 2 10-year-olds, twins. So I'm in that high risk area. And stuff happens. Stuff happens with my kids. Stuff happens with us. So I might take your most expensive plan because it's got a low deductible and co-pays and prescription. And the cost for me, I'm paying the difference between your base contribution in most cases, but even if you're not, the cost of that family coverage is $20,000 to $30,000 a year. And then you pay your contribution. What I'm left with is $20,000 or $30,000 in eating into that $60,000 income. So I take the cost from me for my health care, and then, wait a minute, is that my true cost? Just the cost of my premiums? No, that's for the privilege of using the plan. Forgot about that. So I take my $20,000, whatever it might be, for my annual employee contribution towards that plan. And what's my family out-of-pocket maximum? Because if we're in a car accident, all of us, and they take us to the ER and there's some pretty bad issues, we max our family out-of-pocket coverage. We go right, it exceeds everything. Worst case scenario can happen. Car accidents happen all the time. And that family out-of-pocket maximum is another $15,000 that comes out of my pocket. So I take my $20,000 for the cost plus 15. Now I'm at $35,000 a year is my maximum exposure to use my plan, and I get paid $60,000. Do you see how I got 50%? That is people cannot manage that, which is why household income has been devastated by healthcare costs. So that's the message here, is that this is something that's about your company profits, your earnings and all that, but it's also about understanding the impact to the people that work for you. Your greatest asset is not your building, and it's not your patent, and it's not your fancy marketing ads, and it's not your logo, it's not your trucks, it's not your equipment in the bay, it's not your company name. What is it? It's your people. You can have the best company name and have crappy people, and you're not going to have much of a business. And right now, attracting and retaining high quality people is really important. It always has been. So understand that healthcare goes deeper than just the facts and figures and spreadsheets. So hope this helps. Check us out at MillenGroup.com. Love to have a conversation about some things you may be aware of, you may not be aware of, and we're here to help. All right, see ya.